So I'm here with Dr. Paul Anderson, and we're going to be talking about the AAMP up-and-coming conference, Advanced Applications in Medical Practice. This is the 7th international conference for AAMP, taking place in May in Scottsdale. There's a lot of buzz, Dr. Anderson. It looks like a very dynamic agenda that you've put together. Let's hear more about it.
Yes, we're very excited for AAMP Scottsdale with a focus on chronic gastrointestinal illness. We have probably the best faculty we can put together to execute the agenda that we have, and we're really excited about who's coming. First, we have Dr. Alison Siebecker, and most people who know any of the trainings done around SIBO and SIFO know Dr. Siebecker and her work, and really some pioneering work in trying to educate physicians. We also have Dr. Preet Kangura, and he's from British Columbia, and he is going to be joining in with the SIBO and SIFO portion, and he is an expert on certain parts of SIBO that are harder to test, but also very important in your differential diagnosis. We have a gastroenterologist that most people have probably heard or read papers he's written, Dr. Leonard Weinstock, and he is coming, and we're really glad to have him, and he's going to talk about some very interesting but also clinically relevant things, so mast cell activation and things like extra-intestinal symptoms and signs and how to manage that in SIBO, SIFO. Then we also have Stephanie Grutz, who's a family nurse practitioner who does a lot of very extensive work with inflammatory bowel disease, and then we have myself.
Well, that's an exhaustive but exciting agenda, Dr. Anderson. As always, I noticed that you have 18 hours of CME educational credits over a full 3 days.
Yes, as usual, but if you're not familiar with our scheduling, we pack the 18 hours into 3 very full days, so you get a lot for your time and your money. We don't want to waste anyone's time. And the other thing that we have done, and people generally like this very much, is we have a beginning, middle, and end to 3 parts. So the first section is what's the latest in diagnosing, managing, keeping your patients safe. Also things around biologic medications that are new in this area, and some that are old. In the middle, we're going to talk about the overgrowth syndromes. And again, we have a complete training there from diagnosis through management and prevention. And then the final day, on Sunday, we go all day to the end of the day. So plan on being there till 4:30 or 5. And on that day, we're talking about the immunology of inflammatory and other bowel diseases. So we'll get into mast cell activation, we will get into infectious disease, we'll get into cancer and a number of other things on Sunday. So very, very full days, but you get all of your money's worth and more.
So you're telling me that even though it's several months away to May, you are already half sold out?
We are, yes. There's
Wow.
been a lot of interest in this particular conference, and we did sell out at our last one. So if you are interested, you can go to the website, aampscottsdale.com. There's all of the latest agenda is up there with who's speaking on what, and also all of the registration information is up there, and links to the hotel as well.
Dr. Anderson, we thank you for the background, and we look forward to seeing you in May.